Well, pregnant women, of course, are faced with many decisions, and they often have lots of questions.
And now it appears there's something new they may want to ask their doctors about, the cesarean rate at the hospital where the baby will be born. Today, researchers at the University of Minnesota and Harvard University released the findings of a study that looked at how often C-sections are performed at hospitals nationwide. And it found that it varies widely, and the reason has little to do with the medical condition of the pregnant women. Angela Davis spoke with the lead author of the study. She joins us right now. So the lead author says that this has more to do with hospital policies.
Right. Don't you miss those days?
Oh, yeah.
Yeah. Having a newborn? Those researchers at the School of Public Health at the U of M and Harvard looked at childbirths at 1,300 hospitals in 46 states between 2009 and 2010. Now, on average, the likelihood of a cesarean delivery varied between 19% and 48%. And the reason it varied so much had more to do with the hospital itself than the medical condition of the pregnant mom. The study found that pregnant women could end up with very different deliveries depending on the hospital they chose.
If she goes to one hospital, her chances of having a cesarean may be 11%. And we found in our study that she could walk into another hospital with exactly the same medical history, exactly the same conditions, and her chances of having a cesarean may be 36%. That's a big difference for one woman.
Dr. Katie Casamano says in a previous study, she found the C-section rate at hospitals varied tenfold, from a low of 7% to a high of 70% of deliveries. That got her and her colleagues digging deeper and finding a difference from other nations.
Women's medical conditions and health did not account for the variability at all in cesarean delivery rates across hospitals. So we're doing something differently here. And that leads to the point about why might this be?
She says while women may be very familiar with their doctors, they may not know much about the policies of the hospitals where those doctors deliver babies. Those policies play a role in the decisions that are made during childbirth, meaning moms-to-be need to ask some questions beforehand.
From the administrative perspective, how is a labor and delivery unit run? What are the rules in terms of when someone's admitted, when a procedure is scheduled or not, and how do those rules affect patterns of patient care?
So what do we do with all this information? Ask questions. You know, if you're pregnant, look at where you're planning to have your baby and ask what the cesarean rate is at that hospital, and then compare it with another hospital in your area, maybe two others. Minnesota is one of the states in the study, and the rate is different from one place to the next here as well. So next time, Amelia, you'll ask more questions.
Okay.
Amelia, next time.
Listen, there's a big difference in the recovery time after a C-section, and also the expensive one as well.
Yeah, this is not small stuff here.
No.
Cesareans, yeah, more expensive than natural births, and more is paid out by insurance companies as well. And also your hospital stay is a lot longer, about 5 days after a C-section, whereas with a vaginal delivery, you're out maybe 2 days, or sometimes even the next day. Yeah.
All right. Thank you, Angela.